Hi, it's Gary Chimes from Lake Washington Sports and Spine, and what I want to talk about today is the way doctors can think or should think, and what you can do as a patient to help your doctor think in the way that is probably going to be most successful diagnostically. So there's two modes of thinking that I would use. One of them, or the people that doctors often use, one would be I'll call pattern recognition, and the other approach is called differential diagnosis. For people who are familiar with the social psychologist Kahneman and Tversky, these are somewhat parallel to System 1 and System 2 thinking. So let's say I have a patient who comes in to see me and they have, let's say, shoulder pain. And I'd like to think in terms of Venn diagrams. Ideally, what I want to do is have a list of the 10 million or 10,000 most common causes of shoulder pain. For the purposes of the Venn diagram, I'm just going to show three possible diagnoses. And what these are each showing is, let's say we're doing a shoulder pain, this might be biceps tendinosis, this might be a supraspinatus partial thickness tear, and this might be glenohumeral joint osteoarthritis. And when you're going through the history and exam, these are going to be the different symptoms that are involved. As I hear details, there's some things that will be in the overlap between all three of them. There's some things that might be in the overlap between two of the diagnoses. But if you're trying to figure out what the actual diagnosis is, the most critical element is not the stuff that's in the center, it's the stuff that's in the periphery that's unique to a specific diagnosis. And that can help from a clarity standpoint. One of the reasons that's important is that, first of all, you want to have a doctor who is experienced enough to know what actually goes into each of these different circles and be able to ask specific questions that will go towards those. Those may not be the same things that the patient's thinking about. And I'll just give one very classic example. One of the things that, as a patient, and I am a patient sometimes, if you're having pain, the thing that you might focus on the most is the intensity of symptoms. But intensity is one of these things that's very much in the center of the Venn diagram. All three diagnoses can give you 1 out of 10 pain, and all three can give you 10 out of 10 pain. So they don't tell you a ton of information diagnostically. They tell you a lot about how you're experiencing things, but they don't tell you a lot diagnostically. So when people are doing pattern recognition, they hear a story, they say, oh yeah, it sounds like it might be a supraspinatus partial thickness tear, and then they will hear information in this area and not say, well, what else could it be? And they may lose sight of the other alternative diagnoses and may not get to the other questions they need to think about. So what I think is better for patients is something called the differential diagnosis process. And it's what we're supposed to be taught in medical school, although unfortunately I think we're kind of moving away from it. And the idea behind that is for each of these different diagnoses, as you hear different details, let's say you hear a symptom, you always want to be asking the question, what else can it be? And let's say this third diagnosis, the one shown in red, is like a rare condition. You still want to be asking those questions, and if you can't rule it out, you may need to do additional testing to clarify that diagnosis. So the differential diagnosis process, it's more thorough. So why doesn't everybody do it? And the answer is it's annoying. It can really be kind of an annoying process. You know, a patient comes in, their shoulder hurts, they want to tell their story about what's happening to them. They want to know that the emotions that they're having are valid and reasonable emotions. And they want to know that the person that they're talking to cares. We often have the cliche, nobody cares about what you know until they know that you care. But in the process of trying to clarify things, sometimes you need to go back. So if someone says that their shoulder hurts, they actually say, hey, do you mind pointing by what you mean by shoulder? So for example, I may have people complaining about pain here, and that's really more of their neck than their shoulder. That's important from a clarification standpoint to figure out where you are in the Venn diagram, but it's not necessarily the most validating feeling having someone go back and kind of nitpick and question. But really what you want to be is you want to allow your doctor to be a professional nitpicker and think about all these different diagnoses. So this comes into where, as a patient, you can help advocate for your doctor helping you, which is allowing them to go through their process and allow them to think of all the different things that are going on and then ask questions that are unique to each of these individual diagnoses to make sure they're ruling out alternatives. So this is how you can help your doctor go through a differential diagnosis process and in the end help you by making sure they're not making an incorrect diagnosis by going to rapid pattern recognition. So this is Gary Chimes at Lake Washington Sports and Spine.